So, social distancing within the clinic building. We are putting things in place in order to adhere to strictly social distancing standards that we possibly can. The first thing we'd say is that we ask patients to arrive at their appointment as late as possible, basically, or as soon, not too soon before their appointment. So if they can arrive around 5 minutes before their appointment, but no earlier than that. This just cuts down the amount of people that are in the reception at any one time. We are only operating with 2 out of our clinic rooms at any time, just to ensure that we reduce the amount of patients in clinic at any time. But if you can please arrive just before your appointment, that would be absolutely fantastic to reduce the amount of people we have. Also, if you are being accompanied by anyone to your appointment, we obviously, if people need a chaperone for their appointment and require a chaperone, we totally would not discourage this at all in any way, shape or form. You do need a chaperone, you will have a chaperone, absolutely. However, we do discourage people from bringing other people to the clinic if at all possible. So sometimes patients will bring their children to clinic or their partner who has driven them to the clinic. And we ask if you can reduce this as much as possible. We allow every patient can have a maximum of 1 person accompanying them to adhere to our policies and basically make sure that if they need a chaperone, they can have a chaperone, but they can't have no more than 1 person accompanying them to clinic. Again, this is just for social distancing purposes at this present time, okay? And if that person accompanying them is not a chaperone and won't be in the clinic room with them, then we do ask, whilst the patient is in the appointment with the practitioner, if they could wait outside or possibly in a car or outside the clinic, if at all possible. If that is impossible for them to do, then we appreciate there are going to be lots of different circumstances, but if it's at all possible, we do ask people to wait outside, again, to make the clinic room, reception room, as clear as possible for social distancing purposes. When you get into the clinic room, there will be 2 sets of chairs, one set out near the window, and then 1 set of chairs over near the other wall, okay? We've set them out in 2 sets of 2. And what we'd like patients to do is basically within their group or sort of party of 2, maximum of 2 people, is to sit on the 2 chairs, or the other set of 2 chairs don't sit. Sometimes patients in the past have sat one of them over one side and one of those over the other, but obviously that's not going to be the case now. So within a party of attendees at the clinic, make sure you stick to a set of chairs, a pair of chairs in reception.